about.
Absolutely. You know, when I speak and I use the word obesity and I talk with a lot of medical data, normally what happens is heads bow down and eyes stay focused on the floor. But I stick to my message that those who live fit live better and live longer. So I want to thank you for the opportunity to learn from all of you. I own a gym called Shape Up Sisters. I also was the founder of a nonprofit called Shape Up Mississippi. Well, Shape Up Sisters started because I had a sister who was at a very unhealthy weight when she passed away at the age of 54. To me, it wasn't so much obesity itself, it was the consequences of lack of physical activity. So I became determined that women not have that same fate. 6 months after her death, I opened up a gym called Shape Up Sisters, and I created a social environment there. I created an environment of support and encouragement, because something that I have understood is that even though we have good intentions, life happens. And so all of a sudden we step back and now we stop doing what we were doing. So life happens. So at the gym, you get a chance to come back in and get that social support and that encouragement all over again. So I think social support, the women at my gym, when they come in, many of them met their best friends there. Those that didn't have a social life now have a social life. These things are very, very important to be sustainable, because they have a place that they can come back to for that encouragement and that support. Well, the women in my gym led me to think about something, that obesity not only affected women, it was crippling the very foundation of our families. And those women would say things to me like, I wish my husband would get off the couch, or can my daughter come in and work out? She's twice her normal weight. That led me to think about the community. So even though the women are getting healthy, what they go home to was still happening. So I reached out to a wider community and mobilized the support of elected officials, churches, restaurants, other gyms, hospitals, anyone that would hear me. Well, through our efforts, the town lost 15,000 pounds. Now, through that effort, what happened, we had trial and error, but we created a walking club. It's something that I find that everyone can do. There is no jumping jacks, nothing like that. You just walk. Number one activity in the world is walking. With that walking club, we purchased 5,000 t-shirts, and it said, Shape Up Vicksburg, Get Healthy Walking Club. And what happened on that shirt was a brand that said, walking is cheap, life is priceless. And when you wore that shirt, to give you an example, a man in Walmart said, excuse me, ma'am, you know what? I like your shirt. Life is priceless. My wife has cancer. So we're delivering a message out there and branding this of how important it is for physical activity. As we moved on, we started partnering with other agencies. We partnered with the university and the city of Vicksburg to do the first of its kind citywide community garden. What this garden is about is teach churches and teaches civic clubs, whoever would be there in individual families, how to grow healthy foods, how to get physical activity. Then you take this back to your community, and you can grow a garden in your church to teach the parishioners how to grow their own healthy vegetables. Also, you get physical activity where the university and myself, Shape Up Sisters, come in and show you how to do those activities. Therefore, you're able to teach it to the rest of the congregation. So now what you have is a health coach right there in your congregation that's delivering this, because what more important word than there is than a preacher to deliver it to you? So, and it works. The other thing we do for Shape Up Sisters, we go into the workplace, because we have found that in the workplace, people just don't know what to do, and companies don't know how to start a wellness program. So we go in there and show them about body composition, fat percentages, weight on a scale. But we also, the number one thing we tell them is that what you do has to be social. If it is social, people would participate. If it is fun, people love to interact with each other. Something that I have truly found out, that I know for sure, is that we all want to do better, but we all need help.
Thank you.
Okay, Sean, you want to share a little bit about DC scores?
Can you guys hear me all right? Kind of set me up after Linda here. That's a tough act to follow, but Sean Hinkle, Program Director at DC Scores. DC Scores, we build teams through free after-school programs for over 1,500 low-income youth here in DC at 44 elementary and middle schools, instilling self-expression, physical fitness, and a sense of community. We do this through a very unique model that combines soccer, poetry, and service learning. So you guys had the activity yesterday with Katrina, so you might know a little bit about DC Scores, but I'll tell you a little bit of the ins and outs of how we work. So we hire teachers to run our programs in their schools. So at each site, we have 2 writing coaches and 2 soccer coaches that lead a team of 32 students, 16 boys and 16 girls. Each week, they will have 2 90-minute writing sessions, 2 90-minute soccer practices, and then every Thursday or Friday, an official game day, where we'll bus one of the schools from their site to another school so they can play a different neighborhood, a different group of kids, meet new friends. Sidelines are packed with parents, administrators, students, people from the community, everyone just cheering the kids on. It's a wonderful environment. That's an additional 270 minutes of soccer that we provide the students each week. Share a little bit about some of our evaluation from this past year. 78% of our students improved their BMI percentile, 65% increased their aerobic capacity. Of those that, of the DC Scores participants throughout the whole year, 100% feel confident they will graduate from high school, 95% feel a lot of pride in themselves, and another 95% feel like they're a positive part of their community. So the program has a lot of different ways to connect. For us, it's about providing the opportunities for the kids to succeed in a very encouraging environment. So it's 2 different things that we provide the community that we think that they wouldn't have otherwise. A little bit of history of DC Scores. So we started here in 1994 at a school up the street in Adams Morgan, Marie Reed Elementary School. Pretty organically, teacher was with a group of students after school, started out with soccer, rain, so moved inside, started writing with the kids, picked up, got momentum. From there, the program grew to other DC schools. In 1999, the DC Scores grew into America Scores, and America Scores is now serving about 8,000 kids in 14 cities around. So I think that's the skinny on our organization. I'm excited to be here today. This has been a wonderful opportunity. A lot of our organization's champions are in the crowd, so thank you guys for the support. And you guys unfamiliar with us, thank you for your future support.
Great, Sean. Thanks. Marisa?
Can you hear me okay? Is that on? Maybe not close enough. Hello? Oh, there you go. Okay, so thank you for putting on such a great event. It's been really wonderful being here the last couple of days, to watching all the presentations and seeing the physical activity community come together to create a change in the community and in the culture, as we mentioned. So I'm the project manager for a research study called Everybody Active, Todos Activos, and it's an exercise and healthy lifestyle intervention that began in South San Diego County. The study was funded by the Centers for Disease Control and Prevention through the Prevention Research Center program. And the primary aim of the study was to create a sustainable community program that would promote physical activity among Latinos in South San Diego County along the border. So the study was funded for 2 5-year funding cycles. And in the first funding cycle, we trained 35 volunteer community health workers to provide free exercise classes in community schools, recreation centers, community centers, apartment complexes, and parks. And the results of the first cycle are published in the American Journal of Public Health that showed significant decreases in blood pressure, waist circumference, symptoms of depression, among other fitness and health behaviors. And in the second cycle of the study, a healthy lifestyle program was added to the group exercise classes. And that was really to increase social support for physical activity and keep them involved in exercise. As we know, that's a really, really important part to maintaining them past, a month or two of exercise. In this cycle, we trained 32 community health instructors, and they were trained to give both the exercise and the healthy lifestyle program. Most of those group exercise programs were Zumba or dance aerobic types classes, as you can see in the pictures. And additionally, we added 3 community coordinators who were selected from local agencies, and they were paid to supervise the community health workers to test the organizational adoption of the intervention. So preliminary results from this cycle it was 442 Latina women suggest that participants experienced improvements in blood pressure, waist circumference, BMI, flexibility, and the participants are reporting eating less fat, drinking less sugary drinks over a period of 6 months to a year. During the piece, most notably though, that during the peak of the cycle, we provided 47 free exercise classes every week in the community, just in South San Diego County. And that was at schools, recreation centers, community centers, apartment complexes, through partnerships with 14 elementary schools, 2 middle schools, 2 high schools, 4 recreation centers, and 2 community centers. On average, our exercise classes were about 22 participants. Our program was open to the public, I should say that. And our largest classes reached almost 100 people every single day. During the cycle, more than 2,500 people registered to participate in the program, and that doesn't include the 450 participants at the research study. So now that the funded study activities have ended, 27 of the classes, both free and paid, are continued to be offered in the community by our community partners. So that could be the schools, the recreation centers, it could be the agencies who are providing leadership and supervision. And one of our community health workers actually opened a dance studio, and she offers 17 classes every week, including free classes to the community. And let me make note that she was not an instructor, a dance instructor or an exercise instructor before she started the program. So other community health workers that we work with went on to find jobs with our community partners, other organizations, because of the training that they received through this program. And on average, these community health workers actually volunteered for almost 3.5 years with the program. So it's clear to us that this program, it was not only beneficial to the participants, but it also had a tremendous impact on the community health workers providing the classes. And it also has proven to be sustainable within our community organizations, as evidenced by the maintenance of the program and the classes still in the community. So we're now in the process of expanding and testing the use of this same program within other organization types, including welfare to work type programs. In 2013, we piloted a small study done with the County of San Diego Health of Human Services Department to test the model within the context of the welfare to work program. And although the number of participants was small, it was only 19 women, results of the study showed improvements in health, but most importantly showed improvements in their participation in their welfare to work activities and improved employment outcomes. So when compared to welfare study participants who are not participating in this intervention. So we're now in the process of seeking funding to continue disseminating the intervention program to other health departments and welfare to work programs across the US. And what we found out was that we started this program really looking to promote active transportation and the use of community parks. But what we realized and learned very quickly was that these community members did a lot of walking on their own without cars, and they really preferred to engage in group exercise in a social environment. And they wanted to exercise indoors, even in San Diego. This approach has really added a lot of social benefit, creating social networks for physical activity. Many of these women, it's grown and expanded over the last few years really through word of mouth, not doing any other marketing other than that. And we really can see the benefit of having a community health worker or someone from the community leading these exercise classes as a role model for what's possible for one's life, including physical activity.
Great, thanks.